Diabetic neuropathy is a common yet often overlooked complication of diabetes, particularly in elderly patients with type 2 diabetes mellitus. This condition can lead to significant discomfort and impairment in quality of life, making it crucial to explore effective treatment options. A recent study published in the Rawal Medical Journal sheds light on this issue by comparing the effects of insulin versus combination oral antidiabetic drugs on the incidence of diabetic neuropathy. The objective of this study was straightforward: to determine which treatment approach better reduces the risk of developing neuropathy in elderly patients. Given the rising prevalence of type 2 diabetes, understanding the best management strategies is essential for both patients and healthcare providers. The researchers conducted a well-structured methodology, enrolling a diverse group of elderly participants diagnosed with type 2 diabetes. They divided the participants into two groups, one receiving insulin therapy and the other receiving a combination of oral anti-diabetic medications. Throughout the study, they monitored various outcomes, including the incidence of neuropathy, blood sugar control, and overall patient well-being. The results were quite revealing. The group treated with insulin showed a significantly lower incidence of diabetic neuropathy compared to those on oral medications. This finding suggests that insulin may play a protective role against nerve damage, possibly due to its effects on glucose metabolism and nerve health. But what makes insulin so effective? One reason could be its ability to provide more stable blood sugar levels. Fluctuations in glucose can contribute to nerve damage, and insulin therapy often leads to better glycemic control. Additionally, insulin may have direct neuroprotective effects, promoting nerve regeneration and reducing inflammation. However, it's important to consider other risk factors for neuropathy. Factors such as age, duration of diabetes, and comorbid conditions like hypertension and hyperlipidemia can all contribute to the development of neuropathy. This highlights the need for a comprehensive approach to diabetes management that goes beyond medication alone. The clinical implications of this study are significant. For healthcare providers, it emphasizes the importance of considering insulin therapy, especially for elderly patients at risk of neuropathy. It also encourages a more individualized treatment plan that takes into account the unique needs and health profiles of older adults. In conclusion, the findings from this study provide valuable insights into the management of diabetic neuropathy in elderly patients. By prioritizing effective treatment strategies like insulin therapy, we can potentially reduce the burden of this debilitating condition and improve the quality of life for those affected. Understanding these dynamics is crucial as we continue to navigate the complexities of diabetes care.
If you enjoy the content here, subscribing is the best way to stay connected and never miss an update. Your support helps me create even more amazing videos, and I want to hear from you. Leave a comment with your thoughts, questions, or just to say hi. Engaging with you makes this journey so much more rewarding. Plus, I love getting to know what you want to see next. So hit that subscribe button and let's keep the conversation going.